make us live, please?
Hello and welcome to the meeting of Children and Young People Scrutiny Review Board. I'm Councillor Danielle Lind and I'm chairing the meeting. I'm going to pass you over to Lindsay Stevens just for a quick roll call. Is that okay, please, Lindsay?
Yep, absolutely fine. I'll just go through the councillors first. There's yourself, Councillor Cuss, who's the Vice Chair, Councillor Heselgrave, Councillor Patterson and Councillor Tester also on the call. Co-opted members are Tracy Churchill and Stephen Grundy, and officers present, David Gardner, Assistant Director from Derbyshire CCG, Helena Higgins, also from the CCG, Sue Ann Lim, who's the Director of Early Help and Children's Social Care, Fiona Colton, Head of Service Early Help and Social Care, Tracy Harrison, who's the Chief Exec Safe and Sound and also Youth Alliance, involved with Youth Alliance, Robin Jewis, the Director of Public Health, Siobhan Horsley, Health from Health as well, and I think that's it so far. I think I've got everybody. Thank you. I'll hand you back.
Thank you, Lindsay. Just a couple of housekeeping rules. If you're not speaking, when you're not speaking, please can you keep your microphones muted, please, to avoid interference. And as always, we'll wait for any questions until the end of presentations from officers. Thank you, councillors. Any apologies, Lindsay?
Yeah, Ross McChrystal, Councillor McChrystal, and also Andy Smith, the Director of CYP, Children and Young People, and also Chris Hulse has just joined the call. Please, okay.
Thank you, Lindsay. No late items to be introduced. Any declarations of interest? No. Okay, so moving on to the minutes from the 19th of October. Do we all agree that they're a true and accurate record of that meeting? Take silence as agreement.
They seem to be, as far as I'm concerned, Chair.
Thank you, Councillor Heselgrave. Okay, so we're all in agreement then, unless anybody says otherwise. Okay, moving on then. So item 5, CAMHS and mental health for young people's updates. I'll pass you over to David Gardner for this item. Thank you, David.
Thank you, Councillor Lind. Lindsay, are we putting up the slides?
I'll do it now.
Yeah, please, thank you. So, board will remember that we came in October with a paper that described our strategy towards having a range of targeted interventions.
Sorry, I'm on my way.
That's okay. I'll keep speaking then while you're doing that.
Yeah, I do apologise.
I'll carry on. So a pattern of targeted interventions, introducing new services so that there was some intermediary services between very specialist CAMHS services, child and adolescent mental health services, and the need has been identified by parents, teachers and young people for something that was an intermediary where people could get counselling, help and support without necessarily the need for the full wraparound service of CAMHS. We've introduced something called Building Sound Minds as a new service which is accessible to our schools and to families. What we were going to do is come back and give you some more information around access that relates to those services. The council also had a number of particular questions, which is next one, please. In particular, how we could ensure that services for children and young people are there for children excluded from schools or non-school educated. Something about the average and longest waits for services, although as you will see, this is the difficult time to report on those as our data is still only for October and we haven't yet got the latest data set, which we'll get next month or the year or in February. And then he wanted to know about how the face-to-face offer is working during COVID, and how those practical arrangements were working. So this is an update presentation which covers those things. If you take us forward, please. So since our last meeting, connections have been made between Helen and the Changing Lives operational lead. We've had our CAMHS specialist community advisors meet meet with the in-year fair access and exclusion teams with Jo Ward and her team. And we're trying to identify through that work those pupils who are persistently absent that we can work with. Helen, do you want to come in at this point, since you've been having the conversations with Jo Ward and the team about how we take this forward?
Yeah, I can do. So it's very kind of preliminary conversations that we've started to have, but we're connecting the right people together. And as Dave said, that it's about starting to find a process whereby we can identify those children at highest risk of exclusion and who are requiring mental health support. So we're very conscious that the new Changing Lives teams that start as part of Wave 4 are in the city, and one of those schools in particular, Noel Baker Academy, has a high persistent absence rate, especially for some of the vulnerable groups. And so it's about starting to work with those specific schools and those specific areas with those teams as that additional resource goes into place. The in-fair access and exclusions team has that intelligence, as we say, to identify those particular pupils who are persistently absent, and we're looking at how we can develop those links through to the SCARs as well, who lead on the community triage, which is the process by which we can start to identify which is the most appropriate service for children. So those teams, those children who are in areas where they don't have a mental health support team, they will still be able to access a service through Still Sound Minds or through digital offer or through CAMS. So that's the kind of strategy that we're working towards.
Okay, thank you. Could you move us forward to the next slide, please? Thank you, Lindsay. So access to CAMS, you've got two sets of providers on here. You've got the county, which is County North, Chesterfield Royal data, and you've also got Derbyshire Healthcare data. We thought you'd find it interesting to see how they compare. And from this, you can see that the Derbyshire Healthcare had always been doing some more non-face-to-face digital appointments over the course of the last year. That increased dramatically the previous year. Obviously, it increased dramatically during the COVID lockdown. It is still the case that some face-to-face is still happening. Now, bear in mind, this is October data, and the Trust have been increasing the amount of face-to-face activity since then, but the October data showed that there were 361 face-to-face contacts taking place during that time. These would have been appointments at clinic for children to come and be seen in relative COVID-safe circumstances. The interesting point, though, is that the actual total number of children being seen has gone up considerably. You'll see for Derbyshire Healthcare, their appointments are 135% of what they were pre-COVID. So in terms of access to CAMS, that's increased during COVID. In terms of face-to-face, that has gone down dramatically. But as I say, this is October data, and I would expect to see that the face-to-face data has been improving ever since October, in fact. If I move us forward. So in terms of CAMS demand, as you would expect, we will see since September, schools going back, we've seen a rise in referrals. That's a pattern I think we've seen across most services. And in fact, it's not too dissimilar from the previous year's pattern in terms of referrals increasing. That's probably much as we would expect. If we could move on. So for wait times, again, we've seen this variable pattern. Sometimes you can see wait times drop down, but that could be because we're seeing more urgent cases. And certainly for Chesterfield Royal, they had a spate of seeing people very quickly in urgent scenarios, and that affects your average wait times. But overall, you would see that Derbyshire Healthcare's wait times had risen up to 37 weeks, which was really quite concerning. It's now reducing to 25 weeks at the time of this October data. We believe it should be improving still further, and it was prior to the all of this starting around about 14-15 weeks, which is where we want to get it back to for core CAMS appointments for Derby. So there's a way to go to get us back there, but that's the pattern we're looking at. Chesterfield in the north has a more significant wait time issue, and we have a wait time improvement plan in place with them. That doesn't impact on Derby City. Perhaps what's more important is general access to mental health services, all CYP mental health services. If you want to take us to the next slide, please, Lindsay. And this is the one which is disappointing. And this is disappointing mainly because there's a data glitch. The current arrangements are that all of our providers send data on something called the mental health system, mental health data set, minimum mental health data set, to the centre. And then that can then be interrogated. And as you can see, we can break it down to different primary care network level, which we've done for Derby City here. But because of a glitch within their system, which they're fixing, and it's a national glitch, it's nothing that we've done our end, we can't actually separate out the providers. So this is it's turned out to be a totality waiting list, which isn't as helpful as we would like it to be, although you will see it's in days, and is therefore much less than you would have seen in terms of the weeks for CAMS. Give some explanation to this, the Building Sound Minds waiting list is between about 6 to 12 weeks. If you were to refer today for an individual session for a child, that's the waiting time. For group sessions, for group work, it's less than that. So that gives you an idea of what the core service, which we're expecting most children to be referred to. Why have we got such a huge maximum wait? That is because we can't exclude our neurodevelopment waiting time for diagnostics from University Hospitals Burton and Derby in these figures. And that's why you've got figures of over a year, nearly 2 years in some cases. That's a very separate piece of work, which we're taking forward through SEND board. And the issue there, just to provide some assurance to councillors, is that our research shows that we should be seeing about 8% of the school population for neurodevelopment issues. That's 828 children should be being seen. We've actually got a commissioned service for 2,148, which is plenty. So why is there such a long waiting list? Well, the reason there's such a long waiting list is that the referral rate has been growing at 23 to 26% a year for the last few years, and it's now become completely unsustainable. For a short period of time, it's been closed. The waiting list has been, we've reopened the services from the 4th of January. We can confirm that now. But nevertheless, we are very concerned about the number of children we've got on that waiting list and the length of waiting time to be seen. Stress, this is not for urgent healthcare treatments. It is for diagnosis. And we are putting in an additional sum of money this year to try and help bring us back down and to manage that waiting list. But the real way of managing that waiting list is to address the demand side, which is tackle what's happening with our graduated offer in schools and to get the help and support to families and children when they need it, rather than funneling them into a inappropriate health service, a service that was not designed for the requests that are coming to us. There are all sorts of perverse incentives as to why people might be wanting to go for an NHS psychologist rather than a school psychology service, or referring to other services. In some cases, it's also misunderstanding, as Sue-Ann and others will well know, because we've rehearsed these debates in the SEND board around the way in which people are choosing to go for educational and healthcare plans, EHPs, rather than necessarily getting the help that they need. and people are thinking getting a diagnosis gets them an EHP, and then that gives them some additional resource in some way. In fact, there's no connection between any of those things. But it's worth remembering that's what's behind this huge waiting list. If you move us forward, please.
Sorry, David. Can I just check? Someone's just joined the call and the telephone number ending in 511. Can I just check who that is, please?
It's Steve Grundy. I couldn't get on my computer.
Brilliant. Thanks for that, Steve. Thanks.
Okay, so the similar issue then is, so if you've been seen, how long do you wait for your second appointment? And this is a proxy measure of how long does it take to you to get into treatment. And as you'll see, for the vast majority of the services there, we're talking about days. But again, if you look at the longest, which again is your neurodevelopment pathway, it throws it completely out. What we'd like to do is to come back and give you the real figures behind all of this when we're in a position to do so, which we hope, if it's fixed nationally, will be in the new year. We certainly hope it shouldn't be much longer than that. If you could move us forward, please. So this is a really important graph because we had some concerns, some doubt when we last saw you in October about how access service. We thought we were probably going to hit the access target, but we were not sure back in October. But the data we have now got shows that we are hitting what's known as the rolling 12-month children and young people mental health access rate, which is showing the numbers of children being seen is going up, and we will hit our 35% target this year, which is 10% higher than it was 2 years ago. So we are gradually seeing more and more people each year, which I think is the success of our strategy. And if we move to the next slide, you'll see what lies behind this. So when we look at where children are, who children are accessing, where the referrals are going, the darker blue shows you our previous 12 months up to September 19, and the lighter blue is 12 months up to September 20. And you will see that our referrals have been increasing for Action for Children, and have been increasing for the digital offer, and we've also seen some improvement for Chesterfield, which is welcome. But these new services are coming online, and bear in mind they came online in the midst of COVID, so as they get themselves more established now, we're expecting their percentage of the people being seen is going to go up and up, which helps release some of our resource for our CAMS teams to see those people most in need. Next slide, please. And then if you look at the referral source, this is particularly important because counsellors were asking, well, where are the referrals coming from? Are schools getting access? Is it changing? And you'll see that the referrals, we've got far more referrals now from carers and relatives, slight increase for social services, slight increase for police, and we've seen education service and educational referrals and those other wide range of professional referrals shoot up considerably, which is an indication that our new services are beginning to hit that level of demand that we know has been in the system. Do you want to take us to our next slide? So we have got Changing Lives coming to schools. And you will see that the numbers received of referrals relatively low between April 20 and December 20 because they were new, but that is growing. We've had the Changing Lives offer as a digital offer during the COVID pandemic, but that's now switching again, and there's more face-to-face contact and change occurring even in from November. So that will be useful to come back with the data to show how that's impacting now schools are back. The Building Sound Minds similarly had gone digital, but they have various groups work and so on that's been done on a digital basis, but again switched back in November. And then our CAMS services, which, as we've mentioned earlier, are been using their Attend Anywhere NHS video platform in the main, but again turning on more of the face-to-face assessments as they are allowed to, bear in mind the current state of the pandemic, which we're far from out of the woods on. So in summary, what I'm saying to the committee is that there are signs, very clear signs there, that the strategy of introducing targeted interventions is working. We're seeing referrals from a better range of sources. We are seeing our waiting lists coming down rather than going up, even though we've got a way to go. And this is in the context of increased investment. We've increased over the last few years by over £1 million our investment in our core CAMS teams, but we have also invested in these other services in addition, as well as eating disorder services we're increasing this year. And then there's £1.2 million of investment coming in next year for us to start introducing more crisis response services within CAMS. We're looking at the more intensive community support service to provide care in people's own homes, or whatever they call home. And that's going to be the big development next year. And again, we think that might help relieve some of the pressure of core CAMS in order to see young people for more routine appointments. Thank you for indulging me.
Thank you, David. Thank you. I'm just going to ask a couple of questions, if that's okay, before I open it up to the floor, so to speak. I mean, I think it's absolutely fantastic, David, that progress has been made on approaching people and moving forward to try and reach people at risk of exclusion. I think that's extremely important, and that's fantastic to hear that that is being done. I understand you're seeing more people, but if the referral rate is rising, do you know what the projected demand is moving forward, and do you feel you have the resources and capacity to meet that demand? And also, with the need to reduce waiting times, where do you think the current waiting times should be, and what actions are you taking currently to try and achieve that? And again, in relation to the exclusions, it's fantastic that we're reaching people and children, young people that are at risk of exclusions, but how is the service reaching children, young people out of education, children, young people that are homeschooled, that are school refusers, for instance? Thank you. Lots of questions, David. Thank you.
Do you want me to come in there, Dave? I'm not sure.
Sorry, for some reason my video came off. Am I being heard now? So take them in reverse order, if that's okay. So that's going back to the work about those children who are in school, clearly we do need them to be referred to us, and obviously they could be referred through the normal routes of family and GPs, but we are expecting through the work that we've done with the care teams which are in contact with children that have been excluded, we're trying to make direct links between those teams and these new services so that they can refer straight and directly in. And you saw the different referral rates and the activity going on, and particularly for schools like Bemrose, as we introduce the brand new mental health teams in school, the Changing Lives teams, we want from the very beginning for them to be linked to those children that get excluded from Bemrose, not just those children who are at Bemrose. And whilst that may be just one school, we know that if we can get it right there, we're likely to be getting it right everywhere else as well, because it's be forming the right connections and the network. Because we know it's not just enough to keep publicising, here's a service that people can access and self-refer into. We need to do quite a lot of awareness raising, and we are aware that it's through the networks people become confident to make these connections. So we've started with the team and we'll work our way out. In terms of capacity, that's a much more difficult question, because we're talking about reaching 36% of children with diagnosable mental health problems this year as a system, which is an improvement on the 25% of people we were seeing nationally when this scheme started. That begs the question about what about the remaining children then? Now, not every child should have a medicalised problem. There are issues of resilience and support and so on, and mental health matters for everybody. But But this is a gradual program of increasing capacity and increasing access over the next few years to get us up to a much higher level. And it will be dependent on the government continuing to provide those resources. All I can say at this moment is that Derbyshire and Derby is on track with the requirement to increase the activity, increase the number of children being seen with resources that we've been given. I cannot answer the question about what will happen in the future in any Treasury negotiations, as I'm sure you'd all like me to have that magic ball. I can just say that we are using our resources more efficiently now than we were, and we are seeing more children.
Okay, so does that stand then that you still only have the sufficient funding allocated to address the needs of 1 in 3 children who need the services?
That's the level of funding that we've been given, as would be the case in any other area of the country. It's not unique to Derby or Derbyshire, and in fact we're doing very well. And by introducing the third sector, by introducing the voluntary sector, and by trying to divide up our resources, we are probably getting more impact and more children seen than if we put all of our resources into the top tier of support. We've tried to go some into the top tier, which we've been meeting and increasing, and then we put some into that targeted intervention, and then some into the specialist areas like eating disorder. So it's been a phased approach that tries to hit as many bases as we reasonably can. It has to be said there's a staff shortage as well, so it's not just about having money, it's about having people and growing our people capacity. So as I reported last time, Derbyshire Healthcare would like to have appointed some more senior staff, but they've appointed more junior staff and decided to train them up as a better way of meeting their recruitment challenge, which we've supported them in doing. That's a better long-term strategy. Grow our own.
Okay, thank you, David. Councillor Hazelgrave?
Thank you, Chair. Thanks very much, David, and please pass on my thanks, if not the committee's thanks, for all the work you've been doing, and in very difficult circumstances. And I found it really heartening that you've actually been very agile in terms of how you responded and made sure you got in contact with our young people as quickly as possible. And that's been really important, I think. I think the 1 in 3 issue you just mentioned is very worrying, but clearly it's a national issue, and I just wonder how we as a committee could kind of throw our influence behind urging the government to perhaps fund it more generously, because clearly there is a massive need for it, and it's growing, I'm afraid, because of the total upheaval in young people's lives, particularly older people who are coming towards exams, or are they coming towards exams? That's the issue. Just 1 or 2 things I'd like to ask about. The home educated children are more likely to not access the service, because about the only people who can refer them are basically their parents, who may not be aware of the full gamut of your expertise and services. Do home educated children have differing mental health issues, or are they just the same issues that mainstream children have? And are home care children more likely to need CAMS support? And that's obviously going on the figures you've got that you've reached and the totality of childhood. That's the first thing. Second, what about young carers? Is there any noticeable greater need of mental health services by young carers? And I do, as a statement, I think the waiting lists and timescales to first appointments are far, far too long, but I understand that's out of your hands and it's the 1 in 3 issue. And the last thing, the people capacity issue, of course, is about, it's a national issue as well. It's about training the right number of people, but it's getting people to actually take up the courses, and the government needs to do something about that. Is there anything we as a committee could do to help to get the government to take this more seriously? Thank you.
If you want me to come back on some of those points, and as Councillor Lynn did ask, what would be the normal waiting list, and I forgot to answer that part of the question. 18 weeks or less is what it should be. It's as simple as that, and we're aiming for 12. Our ambition is to 12. 12 weeks for CAM services is what we want to get to. 18 is what I'd like to get to this year if we could, and I'm only hesitant in that because I don't know how this COVID pandemic is going to pan out, but that's what we are aiming for. In terms of the targeted intervention services, we want them to be significantly less than that because we think it's possible to provide that help much quicker. In terms, obviously, any average waiting time precludes the fact that if a child needs to be seen urgently, they need to be seen urgently. And that's part of this arrangement where we're discussing our urgent care plan for next year, or crisis care plan, you'll hear it called. Helen's leading on that. That's what we're trying to use that money to have much more intensive support. But over the next 3 years, we need to get to a point of same-day, 4-hour response in the community for children in crisis. That's the government's target, with funding that's coming through next year, the year after, and the year after that. So it's a 3-year incremental rise. So this committee should expect to see a waiting time that's an urgent waiting time, response time, gradually being reported on. That's what you should expect to see. Not there yet, but that's what we should be seeing. In fact, the teams do prioritise and they do see some people straight away even now. But what we need is routine collection that shows that pattern and how that works. In terms of home educated children, people get home educated for so many different reasons, and I think I would like to separate out firstly those children who have been excluded. Clearly those children who have been excluded and become home educated are likely to have mental health problems, and we really do want them to get access. But people can be home educated for a number of reasons, but where it's because parents have felt their child has been bullied, or their child is sensitive, or they feel that there are reasons like that for not sending a child to mainstream, then one can reasonably think that that child should have some access to some support services. And we would hope that our digital offer, Couth and Quell, available on a smartphone, available on their computer, is a way for a child to access support with or without their parents' permission, of the right sort and of the right quality. And we're hoping that Quell, which is the parents' version of that, is there to give support whether the child is being home educated or at school. So there is some options there, but they still need to get to know about them.
Okay, thank you, David.
Young carers?
Oh yes, sorry. Yes, it's well known young carers are likely to have some degree of emotional problems, not necessarily severe, but they certainly are under some stress, and we think they would benefit from things like the Building Sound Minds programme. And Building Sound Minds do actually run carer support groups, and so Building Sound Minds are always very happy to hear about young carers needing some emotional support and resilience. I think we like to talk about resilience and support and help boosting people's capabilities rather than deficits model. I think many young carers show such strong commitment to their person they're caring for and how they manage in life. You can't help but feel that they've got some good foundations to build upon if we give them the right support.
Thank you, David.
Thank you, David. Right, okay, so if we can move on now to the recommendations. 2.1, to consider the presentation. 2.2, to make any further comments, recommendations following discussion on the presentation. Okay, I'd like to put forward a couple of recommendations. I think my first recommendation I'd like to put forward for the board is to recommend to David that Health works together in partnership with our local area coordinators in relation to bridging that gap possibly between those children and young people that are possibly school refusal, suffering from mental health issues particularly, and those that are homeschooled that possibly may also have mental health problem, and again carers, as Councillor Hazelgrave rightly says. So if the board is okay with that one, yes? Okay.
I'll happily support that, Chair.
Thank you. So no comment from anyone else, so I gather everyone's in agreement. So moving over to my second recommendation, I would recommend that as Chair of Children and Young People's Board, I'm happy to write a letter to the government on behalf of the board stating our concerns in relation to the lack of funding to children and adolescents mental health services in Derby particularly, and the impact that is having on children and young people in Derby City, and I'm happy to do that. Is the board, could the board resolve to push that? Yes, are all happy with that?
Chair, I very much support that, but I think we have to have a rider on that issue of the number of people who are coming through, because if the CAM's got loads of more money and there's no one to recruit because they just aren't being trained, could we add something to that letter to the government asking them to take every effort to increase the recruitment rate, the career path, and making it attractive to people so that we get people in and we've got a workforce that's equipped and competent to deal with the issues if they're appointed.
Absolutely, Councillor Hazelgrave. I'm very happy with that, absolutely. So is everybody else happy with that? Take silence as agreement?
Yeah, that's spot.
Okay, right, so that's passed. Thank you very much. Thank you, David.
Thank you very much. Thank you.
Thank you, David. Au revoir.
Yeah, bye-bye.
So moving over now to item 6, which is the topic review for early intervention youth outreach support. I'll be passing you over to Tracy. Thank you.
Hi, Chair. Hi, councillors. Another guest tonight. Have we got my presentation ready, Lindsay?
We have indeed. Here it is.
Okay, so I've got half a dozen slides, so hopefully shouldn't be too long for you tonight. My name's Tracy Harrison. I'm the Chief Exec at Safe and Sound, but I'm also an active member for the Derby Youth Alliance. And today I'm going to give you an overview of what that Youth Alliance is, what it means, and what we're working on at the moment. And then clearly I'll be open to answer questions afterwards. So if we're going to the first slide, what is the Youth Alliance? The next slide, please. So a number of charities and other organisations have provided youth support and provision. Sorry, can you flick them in, Lindsay?
Oh, wait, yeah, sure.
There's about 4, I think. Yeah, one more, I think.
One more? Oh, no.
Okay,
let's go back.
Sorry about that. So normally there's been a number of youth provision organisations, charities, etc., all doing different things to support young people and provide activities and engagement and interventions. And what Derby Youth Alliance is quite a collaboration where a number of charitable organisations, social enterprises, together with the council, other partners, police, Derby Homes and other partners across the city, have actually got together to form a partnership to actually work collaboratively together, to understand what each organisation's doing, and to work together to try and give the best appropriate youth provision for children and young people in the city, focused in the priority areas and the areas that need it most, supporting the young people and families that need it most, all underpinned by contextual safeguarding. So rather than looking at safeguarding children and young people in isolation, focusing on them, it looks at the family, it looks at schools, it looks like the environment, it looks at the place, and collectively we all work together to support young people and their families in the city with the best support that we can give. Thank you, Lindsay. Next slide. So members of the Alliance, it's Community Action is the vanguard, so they're like the umbrella, so they oversee the Alliance. But there are 5 active children's charities: Children First, Derby County Community Trust, Derby Cultural Education Partnership, and that's got the Quad, the university and Derby Theatre, etc. in that. My organisation, Safe and Sound, and Sporting Communities. And those networks are then supported by, if you just flick again, there should be another one.
Oh, yep, there you go.
And then there's the 5 main charities working with the council partners and others across the city. But then below that, there's an absolute, or surrounding that, there's a whole network of trusted providers. So this isn't an exclusive alliance. Any badminton, sports, theatre, music, any other organisation can be a part of the alliance. And what that allows us to do is to find the best thing to support the young person, or to support the family, or to support the place, and to look at what's already taken place in those areas rather than duplication, and to work with those doing the provision already to add provision and to give the best support. And what it does allow us to do is all of those providers within the alliance has to have certain things like safeguarding policies, health and safety, the right insurance, and actually understand what the alliance is looking to do. So for me, it ups the quality of all of the provision across the city to make sure there's training available, and we can peer mentor, support some of those smaller organisations to actually work collectively and upskill them in the process. So it's a really good opportunity for organisations across the city to work together, to share good practice, and to actually try and tackle problems together, rather than what's previously been seen sometimes in isolation, sometimes even in competition for funding. And it's about focusing on the young people rather than focusing on the money or the particular organisation. Next slide, please, Lindsay. So what's the alliance going to do? Primarily, it's about sharing information and intelligence and what issues are affecting children and young people. So if, for example, an organisation is working in a particular area, there is an absolute responsibility on them to have a two-way process to share that information, and the sharing information protocols in place. There's intelligence submission forms in place. So we're all working to a process and a format that is agreed with the statutory partners and other organisations. So it's collective, and it's not, information on a fag packet. It's got a form, it's got a process. So we share information on the issues, we're sharing the information on the activity that's taking place, and we share information on the effectiveness of what we do. So primarily the aim is to work collaboratively, as I've said, to work together with interventions to tackle, whether that is, at the moment, the pilot's focusing on the youth violence strategy. So that could be ASB, it could be violence, it could be knife crime, it could specifically be exploitation, which is my area. And often, as we know, a young person at risk is at risk of all of those. If they've got some vulnerability, or they're not in mainstream school, or they've got family issues, there's normally some other vulnerability around that actually, if we tackle them all together, we're going to have more success than doing it in different pockets and different boxes. And most importantly, with the youth alliances, it's led by children and young people as well. So they have a voice, whether that's through the this is Derby Youth Persons Forum, whether that's through Derby Homes Youth Forum, whether that's through Safe and Sound Participation Group, whether that's through Derby County Community Trust. We want children, young people and families to influence what we're doing, but also to be able to feedback to policymakers like yourselves of what's working, what isn't, to influence you to be able to make decisions which are more informed by children, young people. So that's, as I say, what we're looking to do. So the next slide, please. So the pilot, it started about 2 weeks ago. It's funded by Derby Homes, Derby City Council, Youth Offending, PCC, and I think the police are putting some forward as well, in another housing association. So there is been a collective pot of money put forward for us to pilot how we will tackle the Derby Serious Youth Violence Strategy, and that is around the services I've talked about. That is around targeting where the need's greater, and it's about engagement both in schools, in places, with families, but particularly focusing those most in need, those priority wards. Excuse me. Next one, please. So this is quite an in-depth slide, but basically this tells you what we're going to do. So a referral will come in, and it can come in. There's all forms been assigned, as I've said, so there's forms with a process. So a referral will come in, and it will come from the council or Derby Homes or whichever partner. It will come through a designated point of contact. So there's some recording and some validation of referrals that come in. The referral will come through to Community Action, who will assess who's best to deal with that problem. So if we look at the left-hand side of this chart, if it's a referral in relation to a young person, or it's relation to a family, then we'll decide what's the best course of action for that. So whether it's intensive mentoring, it's likely to come safe and sound if there's that larger risk around exploitation or around gangs or around knife crime, etc. If it's early intervention mentoring, so there's no specific problem but the young person's in need of some support, it could go to Children First or Derby Arts Theatre, who have a mentoring service. If it wants group support, then Derby Arts and Children First do some group mentoring where it's about building confidence, building resilience, etc. Children First and Safe and Sound already do family support. So again, if it's a wider issue, for example, if a child's at risk of exploitation, no doubt the siblings and family are affected by that. So it may be that there's family support. So in relation to the people, the referral will come in and it will go to the most appropriate agency. Now, it might be that Safe and Sound are working with a young person, but the family wants some support and Children First can support the family alongside. It's not, it has to go to one, it's about us working together. It might be we do some work with somebody and then actually they're confident enough to go into a group session and have some group mentoring. So it really is bespoke, very much children led, very much focused on their needs and what they want. And so that's the left hand side around the people. The place really is about, there's a problem around a school, there's a problem in a neighbourhood, there's a problem on a park, and the first thing we'll do is when that referral comes is look what's happening already. Can we actually get the people who are in that area already to coordinate and collaborate on what they're doing? And then is there a need for some extra work? So is there a need for sporting communities to come in and do some community assurance? Is there a need for Derby County Community Trust to come in and do some kicks football? Is there a need that actually there's a basketball court nearby, so we'll go to a local basketball organisation to see if they can put some basketball on? So it's about reassurance, it's about engagement, and it's around diversionary activities. And that said, the left hand and the right hand can work together. So if we're working on a mentoring side with a young person, but they want to be involved in football, or they want to play basketball, or they want to do some music activities, they can have both sides. They could be having some mentoring, but part of that transition, diversion, building confidence might be they also get engaged in that activity as well. The community reassurance might identify that there's a particular family that wants some specific work, so it can come from the place to the people side. But the whole ethos and collaboration element is we'll work together rather than in isolation to best serve the children and young people in the city. And below that, but not necessarily below, is universal services. So along the whole journey, they'll be signposted and working with other agents. So it might be working with youth offending, it might be working with school, it might be actually that there's some housing issues that we need to resolve around ASB on a particular area. So it's exciting, it's new, it's a joined up approach, and the whole concept fits with contextual safeguarding, not looking at any one area in isolation, and about having that group work together. And then the board, the strategic board around the Youth Alliance, there's partners on it from the statutory agencies. We'll do monthly reviews to see how it's working, because this is new and it's about learning, it's about feeding back. But if the pilot works, this will be the way forward for us all to collectively work for the city, to give the best support to our children and young people. So that, in summary, is what the Youth Alliance looks like. And next slide, please. So what would we like your help with? To hopefully understand what we're doing in the city, to embrace it, endorse it, talk to us about it, feed in referrals if you think there's a particular problem in an area, and actually listen to what the young people say as we feed in their views around what they want within the city, and when we see what's good, what good practice we can learn from, and any particular issues that need dealing with. So that is a whistle stop tour of what we're doing. Happy to answer any questions, chair, councillors, colleagues.
Thank you, Tracy. Just one question before I move over to see if there's any questions from other councillors. Are you looking to further expand the alliance and try and bring in other local groups that work with youth as well, Tracy?
Absolutely. For the pilot, because we've been working on this for a year, at the pilot we didn't want to grow too much. There's clearly other organisations we're working with, the YMCA and some other ones within that. This isn't in isolation, and it's not a group that's not going to allow anybody else to join. For me, any organisation, if they fit the safeguarding, they've got health and safety, they've got the right insurance, they can all be part of the alliance. At what level and involvement will depend on what the need is. So it's not exclusive, and I actually think it will grow to have, hopefully everybody who supports children and young people in the city will be on board.
Okay, thank you. Do you manage to cover the city wide, or is it specific areas at the moment, or is it?
It's citywide, Chair, but clearly it will depend where the referrals come in as to where we focus our area, our energy. We won't be able to be everywhere, so it will be about prioritising. And because it's funded by yourselves and other people, you will steer. If we've got 10 referrals, we'll have that discussion to say, if you've sent us 10, where do you want us first? Because clearly, as we grow and depending what we're able to do, we won't be able to do everything everywhere. And we'd rather focus on a particular area with the greatest need rather than spread ourselves too thin and not actually be able to make that big impact.
Okay, thank you. Before I move on to the councillors, I just want to say thank you. I've heard some absolutely amazing work that you've all been doing, and I think it's showing great resilience of that alliance in these particularly difficult times. Is there any questions from other councillors?
Chair?
Yeah, is Councillor Heathergrave? Who is?
Yep. Thanks very much, Tracy. Really interesting kind of rush through it. I know you're kind of driving fast and accelerating around corners, but it really did give us a flavour of what you're doing, and I'm sure we will be following this as a scrutiny committee in the future with some updates. I'm not going to hold this against you, but I did notice that Abbey Ward was not one of the wards you mentioned where work is being done. Abbey Ward is one of the most deprived wards in the country. And I'm talking about in the UK, so maybe that's just an anomaly for the moment, and it'll be recognised that Abbey does need to be treated on the same level as some of the other wards that you mentioned, and I'm not decrying that there's a need there.
Councillor, if I can come back to you on that, those particular wards were highlighted in the youth violence strategy. Our work is across the city, and clearly, and certainly from a safe and sound perspective, I can reassure you we're in Abbey Ward, and we've just put in more funding for Abbey Ward around some of the areas around Ben Rose, around Stockwood Street, and around some of those areas. So it wasn't excluding those areas were particular to and the serious youth crime strategy. They were highlighted by them, not us. We are in Abbey Ward. We will be in Abbey Ward.
That's music to my ears, Tracy. The other thing now, you've got all this kind of intelligence gathering network now, and the different organisations are sharing information with you. What are the trends in the issues that you mentioned? And I'm not going to give the full list, ASB, exploitation, mental health, etc. Are there any trends that have been noticeable, or is it too early because you've just started as an organisation?
It's probably too early to give a view on the alliance on the pilot we're doing, but I can give you a very much overview of what the trends are in the city. The trends are around the vulnerability and the isolation of young people through COVID, the lack of activity for young people to do. So we've been doing Safe and Sound and Sporting Communities have been doing outreach, and there is that feeling that a lot of services have closed down, and clubs, certainly tier 3 and in lockdown, children, young people feel they haven't got the places to go, and albeit there's been a lot on offer, children, young people, unless they need to access it, they don't necessarily know about it. So a bit like the previous presentation, I think the biggest gap that we found is young people don't know what's on offer, because there's been so much done through COVID. But if young people don't know what's on offer, and part of what we want to do with the young people's group is see how we publicise that using the This Is Derby website, which was designed by young people to try and show what is on offer. So a real isolation, a real increase in mental health and vulnerability, and definitely a lack of things for young people to do, and that increases that isolation, that vulnerability. And often we might be brought in because of knife crime, or a vulnerability around exploitation, or a child at risk of exclusion from school, but there's so much else going on in the background. There'll be domestic abuse, there'll be some alcohol issues, drugs issues. Those other vulnerabilities haven't changed, and I think the concern for me is the the risk to children with SEND, special educational needs and disability, has never been so great for that vulnerability and at risk of those areas that I've talked about. But that's not largely the Alliance, that's me and the city, as opposed to we're only 2 weeks in, but that gives you a flavour from my perspective.
Chair, I think that's a really helpful and valuable contribution in terms of our topic review, and it's something we should keep a note of, because I think we may be trying to delve into that as the topic review progresses.
Absolutely. Before we move over to the recommendations, then, is there anybody else who'd like to ask any questions? Any further questions? No further questions from councillors. Okay, so if we move over to the recommendations, then 2.1, 2.2 and 2.3. Now, we agreed to propose a timescale for the collation of evidence, preparation of recommendations in relation to the topic review. So we have been in contact with the community development manager and community action, the fire service, the constabulary and community safety partnership. I think it would be very beneficial to get to know more about the Alliance as well moving forward within these working groups that we'll be setting up in between meetings. We haven't got time as a board to look at this project in full just at these meetings. So what I plan to do is set up 2 working groups, one being the week commencing the 25th of January and one commencing the week of the 8th of February, if all members are in agreement with that, and I'd like to invite all members to that. I think it would be very beneficial to hear more from these service providers, more from the Alliance, learn more about what the Alliance is doing. I think that would be hugely beneficial, and what they would like to see, and actually work in co-production with the Alliance and services to be able to put forward recommendations that are meaningful and productive moving forward, particularly in these difficult times. I think more than anything, it is really important that youth support is central to our response as a council when it comes to COVID response. Absolutely. So we need to all come together and work in co-production with this. I'd like to know more about the Alliance views, more about children and young people's views. So we will be holding 2 further working groups. I do hope all councillors will be able to make every effort to attend these sessions. So if we're in agreement with these recommendations for 2.1, 2.2 and 2.3, please, councillors.
I support those, Chair.
Okay, thank you. And I'll take the silence as agreement with the rest of the board. Thank you. So moving on to the next item. Thank you, Tracy. Thank you very much for your time. Thank you.
Everybody, keep safe.
And Joe. Right, so moving over next to the Young Carers report, and that is Fiona Colton that will be presenting that. Thank you, Fiona.
Good evening, Councillor Lind and everybody. Lindsay, I think you're going to put up my slides. You'll be pleased to know there aren't many. I've tried to be as succinct as I possibly can. So just while I'm waiting for the slides, I think it's really important to recognise, as it says in the body of the report, that this is a statutory responsibility that the local authority have to provide services for young carers. And we've taken that on since 2015. Prior to that, it was a commissioned out service, and I think it moved back into the local authority in 2015 and moved into early help services. You can move on, Lindsay, now. Thank you. Okay, so young carers come from right across the city and can be any age, really, from 8 through to 17. Currently, on our register at the moment, we've got 40 young people. Referrals come from a range of agencies, so they can come from our own services, children's centres, social care, early help, and often it's when we get a referral that comes through our vulnerable children's meetings that, looking at the detail of the assessment, we think this young person is doing more than just they're actually caring for their parent. And for a lot of reasons. It could be that there's an alcohol or a drug issue. It could be that the parent has a life-limiting condition or something. We also take referrals from health visitors from, that shouldn't say from vulnerable refugees, it should say from vulnerable families in refuges. Very sorry, bit of a typo, but from charities. So all of the charities that that Tracy's talked about in the previous presentation, and from schools. What I wanted to draw your attention to was the piece of work we've done with general practitioners, because I think it's fair to say that young carers can be unseen, really, because lots of young people don't want to talk about what it is they're doing at home, you know, helping their parents, particularly if they're doing personal care and those sort of things. And we've had some real commitment from Jeremy Gibson, who's one of the safeguarding GPs, around getting general practitioners in general to recognise young carers. We were very fortunate. Myself and a colleague and Jeremy Gibson wrote an article which we had printed in the British Medical Journal, which was around making sure that general practitioners, when they're perhaps just seeing a young person, even if it's for you know, a viral infection or something else, that they're asking the right questions, they're using their curiosity to see if they can find out what's happening within the home. And we've done some focus pieces of work with Lister House Surgery around having our banners and things that just draw attention as people are coming through the door, that says things like, are you a young carer? Or to get parents to understand that actually some of what they're expecting their children to do means that they can access additional services. Okay, Lindsay, thank you. Okay, so what is it that young carers do? Care varies and can be something as basic as household chores, but often putting washing in, taking it out, hanging it up, doing the ironing. It can be personal care. So, you know, we have had young carers who are having to support their parents with washing, bathing, showering, going to the toilet, all sorts of things like that. And other things like shopping, often childcare. If you've got you know, an example of a 14-year-old who might have younger siblings, and they're probably doing a lot of the primary care for those younger siblings. What we provide is respite activity often. So to let young carers come away from their daily tasks, to not think about their parents. So we've done quite a lot of work with them out at Darley Barn, so things like outdoor education, paddle boarding, orienteering, those sort of things, or just having some opportunity to sit and watch a DVD together. And usually at this time of year, quite a lot of Christmas activity for them to go out and those sort of things. But we also offer a therapeutic activity and service. So coming back to Councillor Hesselgrave's question about young carers and mental health issues, the Early Help Service does have a full-time counsellor within its service, and part of Paula's work is for priority families, but she has some time to offer therapeutic work and counselling sessions to children and young people should they want it. Often what she'll do is some sort of art therapy or something as an activity, which just gets them to think about themselves and how they're feeling. We also work with our young carers on targeted interventions. So once an assessment comes in, whether it's an early help assessment or a single assessment that's been done by a social worker, we look at what level the young carer needs the support. So is it that they want some intense support that is about helping them come to terms, you know, particularly if a family, a parent has a life-limiting illness? Or is it that actually this young person's just crying out for some respite? If they need more targeted services, we'll pick them up through our early help service, and often do things like, you'll be aware in the past with early help reports, we look at their progression of change over a period of time. We do split the age ranges, so we have juniors and seniors, so really children as young as 8 up to 11 and 11 through to 17. And that's about, when we're bringing them together, that we're giving them the right sort of activities. And I think it's really important to recognise that they do need those respite activities. And the bullet points here tell you that we all know what a challenge lockdown's been. And for those children, it's not been as easy to get them out to do activity or be out on the park, because often they're living with parents who are shielding, and they're shielding because they've got a life-limited illness, etc., or they've got a, you know, might be insulin-dependent diabetic or something that requires them to be at home. So what we've done is a lot of virtual work weekly. Actually, we've been ringing these young carers, all 40 of them, every week, and just getting them to tell us what it is they need from us. We've done shopping, we've done resource drop-offs. So rather than bringing them out, we've sent activity packs to them. So what is it you would like to do? Is there something you need? Can we provide an activity pack? So whether that's been art, creative work, reading. So, you know, if we've perhaps before, when the library's opened, you know, we could go to the library and get library books for them, or provide them with books. And we've also provided telephone counselling, because I think that's the absolute necessity for them that those young people need. So that was a real whistle-stop tour of young carers. I don't know whether anybody's got any questions for me.
Yes, thank you, Fiona. That was very much appreciated. I think the council's got a fantastic offer in relation to young carers, particularly. Just one question before I hand over. How are you finding carers managing education, young carers managing education at the moment, particularly when they've got, you know, they're looking after people that are shielding?
It has been a challenge, and that has been our focus, particularly prior to September. So from March through to July, as well as offering activity packs, we also asked them if they needed any help with schoolwork. And the early help service as a whole, I'm not sure whether you're aware, we've had weekly contact with every school in the city asking about those children that are most vulnerable, and is there anything that school need from us? So if there's anything they can't do, can we do it? So what we've tried to do is focus on those young carers to just say, are they managing to do the work that they need to do? I think what's come out of it is that probably they're doing half of what they could, you know, if you think that children have 25 hours, they're probably getting about 10, 15. But having talked to some of my colleagues, professional colleagues who've had children at home, I think everybody was probably saying they only managed about 15 hours, you know, for the right reasons, really. Since September, most of our young carers, I would say 85%, have returned to school, and we spent quite a lot of time in September looking at whether they'd returned to school or whether there was an issue because of shielding. And what we've tried to do is to facilitate that in some way, as far as can we you know, support, take children into school if they need that, or actually can we have been doing some face-to-face And certainly up until October half term, when it was warm enough, we were doing some work in the gardens with children. But I think it would be remiss of me to say that they probably have missed out a bit, because it's getting a balance. And I would say that's been my staff's anxiety, really, that children, we all know what it's been like to have been in all the time, and for some of those children there's been no break.
Okay, thank you, Fiona. Hand over to Paul. Councillor Hazelgrave.
Thank you, Chair. Thanks very much for that presentation, Fiona. It was very informative, and it was, I really wanted to delve into this as much to seek reassurance that everything is all right, because part of our duty as councillors is to do that. I have been reassured, I must say, and I think it's an excellent reassurance that the 40 young carers were contacted every week. And that there was telephone counselling provided where it was needed. And it's also, I suppose, really good news that we only have 40 young people in the city that have this particular responsibility and all that it entails. And of course, there must be a question, are we sure that it is only 40? Are there some children there who haven't been referred? Is the first question. And the second question, and you've kind of answered this, I think. Do you work with schools so that the school can make reasonable adjustment for those carers that you know about? Also, now on the theme, have we only got 40 in the city? Are schools urged to make sure that you're informed, because there's a statutory duty about this, isn't there? That you're informed if you think someone is, even on the lowest level of being a young carer, that could increase as a disease, a parental disease, deteriorates or becomes more chronic. Are they able to understand that this young carer has specific needs because of that, and that their role of being a young carer, it will inevitably impact upon their work at school?
Yeah, no, I don't think. I'm sure we've got many more than 40 in the city, and I think part of the role, certainly when we inherited it, albeit 5 years has gone very quickly, was we only inherited 20 plus, was to try and raise the profile, and we continue to do that. And I think you summed it up really by saying degree of caring, because I would say that we probably know about those that have the greatest caring responsibilities. So those where we've got, we have quite a young child, a 10-year-old whose mum has a life-limiting illness, and we give those young people more time. So we sort of have almost, there's a general piece of work with those young carers that we just learn about through our own work, or through a social worker, or through a school, where they're just doing a little bit of caring, and we can just check in with them to make sure they're all right. We do much more work with those where it's quite intense, and I think we just have to continue in that way. But certainly the staff team, so it's the early help team in locality 2 who do the intensive work with those children and young people. One of the first things they do is talk to school around homework and timekeeping and things like that, because the real challenge is that if you've got to help your mum get up in the morning, you might not make it to school for 8:30, but you might be there for 25 to 9, and actually, should you get a late mark, sometimes it's a bit controversial, and sometimes schools will say, well, these are our rules, but we try to support young carers and schools to come to a compromise. We run what we call Team Around the Primary School in all of our primary schools, and we're just remodelling that, ready to go out in January. But one of the questions at all of those meetings are, do you have any children who you think have caring responsibilities? So it's almost like an ongoing piece of work to find out where those children are. And in a normal year, and this has not been normal in any way, has it? We would have our banners and things up in libraries, in the front of the council house, and all of those places to try and get, you know, I don't know whether I want to really say that it's like sort of looking for business, but it is trying to discover those young people that are most vulnerable having caring responsibility.
Does that answer your questions, Councillor Hazelgrave?
Thank you very much, Fiona. And, you know, I mean, you might not like the term touting for business, but effectively, if you can get the message through that you're there to support, and it's put in a really supportive way, and that you're keen to get to know them, and you think you could be able to help them, and it could be, you know, it's just how long is a piece of string, how much you help them. It's a question of what the needs are and how willing they are to get them. But it's also, I think, a really important thing that schools I know they have 1,001 things to look out for, but it is a kind of it is a safeguarding issue.
It is a safeguarding issue, yes. Yes,
and with it being safeguarding, you know, it's important to recognise that child, because they're at risk with their education. They're not risk of harm, I would hope, or exploitation, but they are at risk of a deterioration in their education as a result of a factor that's a really strong pull on them, yes. Which is to care for a loved one in the family.
Yeah.
Yeah. Yeah. So thank you very much, and thank you to all the team that work.
Thank you. I'll pass you thanks on.
Thank you.
Thank you.
Yeah.
Absolutely, yes. If you could thank the team, extend our thanks, that's absolutely fantastic. Thank you. So moving over to the recommendations 2.1 and 2.2 to note, the board happy to note their report? Yeah. Okay.
Yes, Chair. Yeah, maybe as a third recommendation to note that we did thank the team involved and wish them every success in the work that they do.
Yeah, absolutely.
Thank you.
Okay, thank you.
Thank you.
Thank you, Fiona. Okay, so moving now to item 8, Robin Dewis will be presenting this one. Thank you, Robin.
Hello, Councillor Lind. Siobhan Horsley, who's one of our senior registrars, is going to be presenting this, as she's been leading on the work, if that's okay.
Thank you, Robin.
Thank you. Linz, can you pop the... Yeah, lovely. Thanks very much, everybody. So I'm just going to talk you through some slides about some work around childhood obesity, in particular childhood obesity strategy. Can you just move me on, Lindsay?
Yes.
So yes, I'm going to talk you through the strategy, just some key points. And then just recognising that the strategy was kind of made into a final draft at the end of last year. And since then, obviously, we've had the pandemic and the pandemic response, and that might, that is influencing our position slightly. And then briefly, next steps. Next slide and next slide. So the strategy, we've developed it to go from 2020 to 2030, recognising that we need a really long-term approach. The focus is on 4 main areas, so looking at children within kind of a family and early year setting, then within education and schools, also supporting health and care professionals in their development around this issue, and then more broadly looking at the obesogenic environment, which is the kind of environment and culture that we all live in that kind of makes obesity, makes us at risk of obesity and overweight in terms of limiting some of the healthy choices we might be able to make, and so on. So as I said, the final draft of the strategy was in January 2020. It's recently been approved by the Children's Partnership Board, and we're taking it to Joined Up Care Derbyshire in January 2021. So that'll be where the oversight of the strategy sits going forward. Next slide, please. So there's two kind of clear tracks to the strategy, two objectives. So the first is about supporting those children who are already overweight or obese to be able to access joined up support that's kind of wrapped around them, and that can be long-term support, recognising that this is a long-term issue in terms of reversal or improvement of the situation. So what this means is that we want to, all our systems are in place to identify children who need the support and then provide the support that's needed, that's most effective for them in their situation. And so that's kind of the response angle of the strategy. And then more broadly, we want to develop and improve our preventative approaches for current and future generations. And to do that, we need to take a whole systems approach, which kind of coordinates all our existing efforts around prevention. We can really target any gaps. We have that system level understanding of what's going on and supports use of resources. And that's where we start to think about kind of the environmental approach. And the reason all this is important, next slide please, kind of our prevalence rates for obesity. So I've got two slides here to show you some data. This first one is in reception year. So the nationally there's a weighing and measurement programme for children that happens in reception and in Y6. And that's done on an annual basis. So the most recently released data is in 2018-19. And this annual measurements have been going on since the mid-2000s. So you can see that Derby has been pretty much tracking the national average up until 2018-19, when there was this bit of an uptick towards it's about 12%. I know it's difficult to see on the screen. So that's when we kind of diverge from the national average, and because we're still waiting for 1920 data to come through, we don't know if that's a blip or whether it's the start of something more significant. The next slide, please, shows the prevalence in Y6, which is a slightly different picture. So you can see here, so in reception, most recently there was about 12% of children who are obese, and that does increase to over 20%, up near 24% in Y6. And we can see here that yes, we kind of tracked national average until maybe 2012, but since then we have diverged from national average and we are kind of consistently above for the last few years. So this is the context in which kind of strategic partners got together to think, well, actually, we need to be doing something differently, don't we? And kind of taking a more coordinated and strategic and joined up approach, we hope. And the idea is to kind of bring those levels back down again. Next slide, please. So that was the situation where we were. And I suppose that at the time of writing the strategy and getting people together to think about it and plan new ways of working. And then obviously we've had the pandemic and the response, which has had an impact on both services and children's weight. Next slide, please. So what we are concerned about is that we're starting to see some anecdotal evidence from service partners that rates of obesity in children have increased during this last year, so during school closures and since then. And within that cohort, we're also seeing a shift to children being more overweight, so more severely obese within that obese category. Our actual data will start to become available as the National Child Measurement Programme is underway again this year. And what we think is that we're likely seeing the influence of a significant change in lifestyles during that school closure period and follow on. And I think, we can reflect on our own lives about how our habits have changed and how we've made different decisions about things during that time. There were other things going on and that loss of structure and so on. Next slide, please. We did speak to Voices in Action about this issue and asked them specifically how the lockdown and school closures affected eating and physical activity. And you can see from here we've got a response So on the one hand, it became, for some children, it became a really supportive environment. People were at home, they were eating together, and they felt that they were having healthy foods and they weren't skipping meals so much. Some did more exercise because they had a bit more time, and some things moving online made things more accessible for people. On the flip side of this, some children reported eating more, comfort eating, boredom, stress. Food is readily available at home, so there was no set meal times. They felt they couldn't do the sports they did before, they couldn't leave the house as much, and there was just that lack of routine. So you can see these two stories kind of coexisting, and sometimes, you know, you may move from one to the other depending on what's going on. So it's quite a complex picture, but I think what is clear is that there has been a change in children's relationships with food, meal times, exercise, and so on. Sometimes for the better and sometimes more negative. Next slide, please. From services, we also spoke to services, and what they described, so obviously everyone across the NHS and the local authority have kind of had to change the way they work as well, and there has been a reduced offer during that lockdown period, and definitely this move towards virtual services was seen there. We can see there was redeployment of staff, so for example school nursing and so on, towards COVID response. There was increased staff absence due to COVID and contacts and all the rest of it, and also the school's closure kind of reduced that environment for contact. But what services did manage to do was provide a virtual offer on a one-to-one basis for those children identified as needing support. There was some progress towards implementing the Henry programme, which is a programme for preschool children. It's health, exercise, nutrition for the really young. There was some initial work done to look at developing referral pathways. So everything's just tightened up in terms of referring obese children from that NCMP weighing process in nursing, targeted one-to-one support. And also there was a lot of work, as people will be aware, that around food in the community sector, voluntary sector, including kind of this Food for Thought Alliance. So there was kind of a combination of things, some work being done and some new things springing up and new ways of working. We couldn't do the National Child Measurement Programme because that takes place in school, and obviously there was no in-school offer for activity services, and some of the kind of the whole system obesity work was paused, and some of the commissioning activity was paused during that time as people had to focus more on the pandemic. Next slide, please. So the national agenda. So it also kind of at this time, the national picture, there was a shift to look at obesity again and really redraw people's attention to it, particularly as a risk factor for COVID-19. And this prompted policy paper from government in July, which promoted the Better Health campaign, talked about investment into weight management services, looking at just revisiting how we communicate to the public about kind of what's in our food, calories and so on, and just kind of restricting some of the advertising and promotions. And those last 2 points are very much, they kind of fall into that obesogenic environment agenda. So it's about kind of just how do we shift the kind of the focus of the environment away from some of these issues that we know are difficult. Next slide, please. And again. So what we've done so far is just set out a little bit of context and bringing us up to date. We recognise that at the moment we're still under, everybody's still under a time and capacity pressure. We're still, schools are not in a straightforward, there's not full access for services to schools at the moment. There's a lot going on and schools are under a lot of pressure. So our priority is really trying to do what we can for those children that we are already aware of. So that's strategy objective 1. So really trying to understand what the current picture is for children in Derby at the moment. So looking at our current data and just sorting out those referral pathways so we can easily provide children the support that they need, and some development work around kind of safeguarding protocols to be able to, for social care colleagues to be able to refer into health effectively when they kind of spot an issue or become aware of an issue. Further work to extend the preschool programme, and some further work to start progressing this tier 3 weight management, and again kind of working with our community assets and community and voluntary sector. Next slide, please. And then, so that's kind of our plan for the next few months. And then kind of going more fully into next year, thinking about, well, actually, what have we been able to do? What's worked? What do we really need to focus on next? So a bit of a review and next steps process. Really kind of looking at what is our new baseline. So I showed you the charts earlier on. We think our baseline may be more challenging. So it's trying to understand this and what's going on and where do we need to prioritise work. So and just to go back to that kind of twin track approach on the service development as well as the prevention and the whole systems approach. And I think that's it for me. That was my final slide. Thank you, Lindsay. So yes, I'm happy to take any questions, comments, Chair. Thank you.
Thank you, Siobhan. Thank you very much. And it's great to see that review work is going to be taking place on this really important issue. I'd just like to expand just a little bit more about how children are being identified and referred to the service, if that's okay. Thank you.
Yeah, so the usual process would be through, I suppose, that standard kind of national way process, which comes in kind of in reception and Y6. Additional to that, there would be kind of through schools and through relationship with school nursing, and then other kind of services that go into schools, so like the Active Schools programme, they go into schools and have a look at what's, can do some targeted work with children within that setting.
Okay, thank you, Siobhan. Any questions, Councillor Heselgrave?
Thank you very much, Siobhan, for taking us through this, and I fully appreciate that the COVID thing has knocked you completely for six, because it's really essential that you work with families and they've enough on their plates, in a figurative sense, at the moment. And I think just work with families is so very, very important. I mean, I look back to my childhood, and I was never asked what I wanted for my tea. I was never asked what I wanted for any meal. I had to ask, what we having for tea tonight, ma'am? And my heart would sink on a very rare occasions, usually in summer, where ma'am said, I think we'll have salad. And that meant a few lettuce leaves and a very, very thin slice of ham and a few tomatoes. And I was absolutely starving at the end of it, but I couldn't say anything because that's what I got. And where I contrast that with my brother today, who ended up with 3 children, 2 twins, and a daughter a bit later on. His wife is a vegetarian to start with, so he's always had to cook 2 kinds of separate meals. But he eventually actually cooked 3 meals for the 3 different children, because he pandered to what they wanted. He always made sure it was healthy, but the complexity of his kind of menu that he had to do for an evening tea, the kind of preponderance of food we've got in society now is not in many ways a good thing, because it's leading people to misuse that privilege of having an abundance of food. And I really do think that early intervention and getting parents clear on what messages they give to their children early on. And I know the Henry programme was very effective on that, and there's clear evidence that it was working. And I know that this may have been taken on slightly before before Henry became highly significant in terms of the pathway forward on this. And of course, Boris Johnson's experience and him losing weight, he had a sudden flurry, as usually with him, on urging people to lose weight, and having there's a national strategy that came out in July, and then not a word further about it since, partly presumably because he's lost weight and he doesn't think it's an issue anymore. And if it's not an issue for him, it's not an issue for the country. But I mean, that's the way it works, isn't it? But I do think early intervention is really important, and I do think this is really, really important work, and it will have a vast impact on young people's lives if we can turn it around in terms of their health long term, and all sorts of conditions, and their mental health, their social, their feeling of self-worth, all those kind of things as well.
Yes, thank you. And I think what we're trying to do is both support that kind of universal approach. So, for example, working with health visitors and so on in those early years. And then there's a policy approach, which is the kind of around the promotional things and kind of planning. And then there's the targeted approach for those children who need it. So it's trying to proceed in all avenues at the same time. Thank you.
Thank you, Siobhan. Thank you, Councillor Hazelgrave. Okay, so if we move on now then to the recommendations. So 2.1, 2.2, to consider the presentation, to make further comments, recommendations, following discussions on the presentation received. Any recommendations?
Chair, just that I fully understand that the COVID thing has really knocked all this for six, and the data collection's been thrown out. But I would like to be kept informed, and I would hope the committee is, in terms of relevant data that comes out, not necessarily in the next 6 months, but over the next year. Hopefully over the next year we'll get something that tells us one way or another whether it's an increasing problem or we're starting to get a handle on it or whatever. And there, as a result of what we find out, what strategies or what responses going to be in the light of that. I would just make that, I know it's kind of a bit of a long wordy thing, but if we could make something succinct about that, I think that would be a good recommendation.
So put forward to bring back to board next year, is that right, Councillor Hazelgrave? Yes, I'm happy with that. Is everyone else happy with that? We move on? Yeah.
Yep.
Everyone happy? Okay. Right, moving on then. So item 9 now. Suan, monitoring safeguarding practice. Thank you, Suan.
Yes, thank you, Chair. Good evening, Scrutiny Board members.
Good evening, Suan.
Hello? It's gone dead.
Hello?
Hello?
Right. Is the chair still on the call? Are you there, Councillor Lynn?
Yes, I'm here.
Have we just lost Suan?
I think we've lost Suan, haven't we?
Yeah, by the sounds of it. Do you want to try and...
No, I'm waiting for the president. No, I'm still here.
The presentation's up, I think.
Yeah, I'm here. Lindsay, are you putting up the presentation?
I have put it up.
No, I can't see it.
I can see it.
It's up on my screen.
Can you see it?
Yeah, it's there.
Okay. So, apologies for the delay. So the report's, I can see it now, great. The report's going to cover, if you go to the next slide, please, Lindsay.
Sure.
Report's going to cover three key areas: the response to the second lockdown, how we monitor and assure ourselves of quality with safeguarding services, and the overall pressures and current performance. And I last provided an update to Children's Scrutiny back in September in respect of our initial response to the lockdown. And I talked a little bit about our future operating model in the knowledge that our practice and delivery would be changing. And we developed that in July and August, and we were just starting to programme, next slide please, Lindsay, in September. So we just started to open up all of our offices, and we have made sure that they were COVID secure, that we'd undertaken our risk assessments, and so, sorry, it's not moved on, Lindsay. up all of our offices, we'd risk assess them, made them sure they were secure, and we'd got our staff working back with
I think we're getting
working more with.
Hi, Suan. I think it might be worthwhile just turning your video off, possibly, because it's that keeps coming and going. That might help. Thanks.
Okay. Okay. Is that better?
I think so. I'm on the monitoring quality slide. Is that not right? Which slide are you on?
No, we just need to be back on the
on the response to second
previous one. Yeah. So sorry, I don't know where you didn't catch me from. So essentially, we just started our recovery plans that commenced in September and opened our offices, and we'd increased our contact with all of our open cases from September. But clearly, we were aware that the rates were increasing from mid October onwards. So part of the work that I did with my senior leadership team was to ensure that we had contingency plans in place. We were really aware where the national direction of travel was going. We had lots of relevant information from our public health colleagues, so we were aware that rates were increasing and actually we were probably heading for another lockdown. And by the 23rd of October we had contingency plans in place to ensure that we were ready should lockdown happen, and that eventually did by the 2nd of November. And actually our experience of going into that second lockdown, we were ready and confident. We had plans in place, and I think, you know, because we'd already been through that previously in at the end of March and April, things around that caused more of the issues during the first lockdown, such as the IT elements, etc. We already had that in place. So actually, in terms of moving into responding to those restrictions, it was actually quite unproblematic. So we were in a strong position there. And similarly, because we'd also risk assessed all of our young people, they were already subject to a dynamic risk assessment. So again, professionals could look at that risk assessment and determine whether or not direct contact needed to be maintained, or actually virtual contact would be safe on those occasions. So that again worked really well, and we were very au fait now in terms of our contact with young people over virtual means such as Skype, etc. So overall, our response to the second lockdown was unproblematic. Okay, can we move to the next slide, please, Lindsay?
Just moved it along.
Thank you. Okay, so in terms of monitoring quality, we already have very robust systems in place, and actually this hasn't changed during COVID at all. So for Scrutiny members that are not aware, there is a monthly strategic safeguarding meeting that is attended by the Chief Executive of the Council and the Cabinet Member for Children and Young People, and also the Director of Children's Services, and that is a monthly meeting that looks at and receives information regarding current pressures within safeguarding services, caseloads, and challenges that are presented, and that's to ensure that there is line of sight directly by the Chief Executive and the Cabinet Member direct to the operational shop floor, which again provides that opportunity for them to understand the current pressures, but also to unblock anything that's needed. So there is a good line of sight at all levels. Then we also have, and again this has been running, our monthly performance and development board, which receives all of the reports around our auditing work that we do, and again that has continued, and managers have continued to make sure that we are constantly looking at cases. And if people are not aware, at any one time we do have 3,500 cases open to us, so we do have to regularly audit cases to make sure that they are of sufficient quality and level, and be able to be in a position to report back on those. We have developed weekly monitoring reports through our corporate performance team, so that I'm aware, my heads of service are aware, the Director of Children's Services is aware if he wants to understand all of the data that comes through, so the number of referrals that are coming through by partner agencies, the type of referral that's coming through, so that we can keep scrutiny on the levels of need, and also different trends that are emerging. We have resumed our case audit programme from August. I last reported to the Scrutiny Board that we undertook some specific COVID audits around child protection, looked after children and children in need, but we have a general programme that looks at wider cases, and we resumed that in August and continue with that. And we also have made sure that we have recently reviewed our supervision arrangements as well for staff, because we're aware that they have been continually delivering services during this period without any breaks, so ensuring that supervision is provided to our staff. Okay, can we move on to the next slide, please?
I've just moved it to the pressure slide.
Okay, so not in the report, but I've put a slide on around actual pressures. Because we continually we're seeing demand has risen from April, and this is directly related to COVID. So just to put into context of numbers, so we've seen a 6% rise in contacts since April, and contacts are the partner referrals into our multi-agency safeguarding hub, and we have in any one month between 1,750 and 2,000 contacts that come in from partner agencies who want to let us know that they're concerned or that they're worried about a child, and all of those individual contacts have to be considered by a social worker to see whether or not they need further assessment, etc. So a 6% rise has meant that, you know, that's been an extra 120 a month of those contacts coming in. And we've seen then arising from those contacts that when it's a 16% rise in referrals, then that means then that's on to the next stage of undertaking an assessment. So again, we've had a 16% rise in all of those contacts that are now then requiring an assessment, which again has been quite significant. I think we've mentioned already this evening and touched on the fact that domestic abuse referrals have been prominent. So we've definitely seen a rise in domestic abuse as part of those referrals coming in from partner agencies, and actually quite a significant increase. So that's been a 27% increase, and actually domestic abuse accounts for 47% of all contacts that we get into the multi-agency safeguarding hub. We've seen a rise of 5% early help cases open, and if I kind of give a flavour, at the end of November, that we had 1,135 early help cases open, you can understand the level that we're currently working across the city with early help. We've had a 2% increase with children with a child protection plan, and that is one of that's the highest level of risk that a child can be subject to, and this is where risk is imminent or has happened or is significant, and they've had to be put on a child protection plan. And we've got over 450 children subject to a child protection plan within Derby at this present time. And we've also had over time a 9% increase in the number of looked after children. And we've currently got, as of today, 641 looked after children within the city. And as I've said, overall, we have over 3,500 children that are currently being worked with by my services across early help and children's social care. Next slide, please, Lindsay.
Performance.
That's right. So in terms of the performance, I appreciate that we have experienced a huge amount of pressure and increase over these last years. We're maintaining a really clear and robust focus on what we need to do. So this is an overview of what our statutory requirement to be, and despite the additional work, the performance is quite phenomenal by the staff. So we have a statutory duty to ensure that any child who presents as with significant risk is presented at conference within 15 working days, and 95% of those children have those conferences within those 15 working days. We have maintained that 96% of our single assessments are completed within the timescale, and the statutory timescale for completion of an assessment of the family and child is 45 days. 96% of children in need reviews are completed within timescales, and those reviews need to happen every 3 months. 86% of child protection visits are completed within timescales, and those timescales are subject to the plan themselves, but must be no longer than every 20 days that a child must be seen if they're on a child protection plan. And those reviews must be completed within, they're usually scheduled again every 3 months, every 3 to 6 months, and 94% of those are completed within timescale as well. 91% of our children in care statutory visits are also completed in timescale, and they must be seen no less than every 6 weeks during the first year of being looked after, and then at a 3 to 6 months timescale. And all of our children in care reviews were completed within timescale, with a participation rate of over 96%. So it's quite a phenomenal performance, and all my teams are working really, really hard, and there's been absolutely no let up during COVID. And I do appreciate that it's my own service, but I'm incredibly proud and humbled around social workers' commitment and the over and above and going the extra mile that they have done over this past 9 months. And I hope that again will be a reassurance to yourselves that we are absolutely doing as much as we can for the children of Derby. And I'm happy to take any questions on that from councillors. Thank you.
Yeah. Thank you, Sue-Ann. Wow, that's amazing. That's absolutely fantastic. And I'm sure the board will join me and agree that we'd like to extend our sincere gratitude for the continued hard work and dedication of our social work team and our staff in our safeguarding services. And I hope you'll pass that over to them. You've done some absolutely fantastic work going above and beyond. I would like to ask, do you have a good idea of the projected demand moving forward, Sue-Ann?
What we are looking at forecasting, and we've now got what's called an algorithm that we are looking at, sort of like trying to predict trends, you know, past sort of like 6 months, and we're looking to sort of like a 3 to 5 year forecast. We've done this very much with our looked after children, so we've over this last year, and we've been pretty much absolutely bang on in terms of the numbers that we've predicted. So this last year we've been correct in that. In terms of, the demand is going to steadily increase, and in the next year I'll be able to bring a report back to Scrutiny on that work, but our corporate performance team are absolutely looking to see how much they can help us with the intelligence around what sort of like the 3 to 5 year landscape actually looks like, because that's really important for us to be able to plan our services, because there's only so much that we can absorb, and that keep absorbing additional work before eventually performance deteriorates, or actually, heaven forbid, you know, we miss a child protection case. That hasn't happened at the moment, but I think absolutely we are absolutely focusing on trying to get an accurate forecasting of where we're going.
Thank you, Sue-Ann. So are you confident that we have the capacity to be able to meet demand moving forward?
We have at the present time. It's pressurized and it's stretched, but we are safe at the present time. The plan is to undertake that forecasting exercise so that we can be absolutely on the front foot moving forward over the short to, you know, the next medium to long term, because I think that's really important for children's services. I think there's a lot of latent need in the system. We don't know yet what all of COVID will bring us. I think some of that is coming through, but I don't think we have received, you know, we've experienced all of the impact of COVID in terms of what that will mean for us yet.
Okay, thank you, Sue-Ann. Councillor Hevilgrave, you have a question?
Yes, please, Chair. Good evening, Sue-Ann. Thanks very much for that very detailed report, and it was very heartening to look at the last figures on the performance, and as you said, the phenomenal response to the increasing pressures. And of course the worry that, as you just said, that there is a latent need that's going to unfold over the coming months, or maybe later than that, and would hope sooner the better. But I am concerned that, you know, these pressures you're having, it's a national picture, surely. And it's worrying that at some point or other you will need to have recourse to actually getting more bodies on the ground. And you're going to find it difficult to recruit, because everybody will want to recruit. And the careers, you know, the people coming into the career aren't as numerous as we'd like, and that's partly because I don't think they get a very good press from certain sections of the media, which makes it kind of difficult. And it's obviously extremely demanding and very, very important work that's held to account sometimes very severely if things go wrong. So I am worried that you know, we are ready to actually respond to the need and the pressures by recruiting and having some reassurance that those numbers will be there when we need them, because I do think that is going to be an issue, and I'm sure it's a worry for you all. But I must say that you know, those figures, it's kind of sad to see those figures increasing in terms of the pressures, but it's good to know that they're in the system. You know, there's that thing that at least they're getting an eye kept on them, and they're coming into the system and being supported. And it's just, you know, the nature of COVID and what it's done in society, and now it's the cracks that were there have completely been rent asunder, haven't they? But I do think this issue of the pressures and how the authority responds is really important.
Yeah, no, I completely agree with you, Councillor. And in terms of the recruitment side, we have a very strong workforce development section. I have reported around our recruitment in the past. We have a good retention rate of our social workers, but sometimes retention of those that are very experienced is very difficult. That's a national issue. So we don't have any particular issues with recruiting newly qualified social workers, but they need time to build up their experience. So I think that it will be it's a national pressure, the shortage of social workers. But I can report back on terms of our recruitment and retention strategy at the next scrutiny, or the next time we talk about monitoring safeguarding, because I think that really is an important area to actually report on. I think that'd be good to see that and what the pressures are, so that we can make recommendations that would be supportive of you. Thanks very much, Swan. Okay.
Thank you, Swan. So, okay, moving over to the recommendation now, 2.1, to note the content of the report, pressure and plans in place to address the future challenges. So, all noted? Yeah. Okay.
Yes, Chair, yeah.
Okay, so thank you. So, we'll be moving on now to item 10. So, I think this is Swan again, isn't it? So, passing over to you then, Swan. Thank you.
Okay, thank you. I'll turn my camera off, and Lindsay, if you can put the presentation up, please. Thank you.
It's up. You should be able to see that.
Lovely.
Yeah.
Okay. So apologies from my head of quality assurance. She can't be here tonight. So Jasmine was going to do this report. So if we move to the next slide, please. So I'm absolutely really delighted to present the 10th annual report for child-related exploitation. We've actually come on a long journey over the last 10 years. So we started with child sexual exploitation, and this has gradually now morphed into child-related exploitation as we learn more about what exploitation actually means. So child-related exploitation encompasses sexual exploitation and child criminal exploitation. And this has meant, quite a different view in terms of who is included within that sphere within Derby. Essentially, there's three planks to our success within the city. We have strong governance, which is led by our Director of Children's Services, Andy Smith. We have excellent partnership working, because tackling child-related exploitation in whatever form it is cannot be done in isolation. It has to be a partnership approach, and we now have very robust systems in place to support children and young people, and also identify those ones that are potentially subject to exploitation. Okay, next slide, please. So this report actually covers, we're a year previous. So the report covers the 18-19 recommendations, but we're also nearly to the end of the 2019 report. But essentially, all the recommendations that were expected to be undertaken have been completed. So there has been training undertaken and delivered for licensed premises, and that's including taxi drivers and hotels. And the Say Something If You See Something campaign still continues, and led by police and our licensing partners. We have captured and developed our data analysis in a much more sophisticated way, and have a new system linked to the social care case management system that allows us to draw reports out. And we also have offered training directly to young people, and this includes tailored sessions with children and young people in specific settings, etc. And also early help have provided sessions in schools also. Next slide, please. So what's the data telling us from 18-19. So we've had 107 cases of child-related exploitation. And this has actually been a decrease from the previous year. We had 132 the year before. We've had an increase in boys being referred, which has been very interesting, and I think that's to do with the expansion of child criminal exploitation as opposed to just sexual exploitation. And again, we've had, as I said, with the introduction of criminal exploitation has seen quite a significant rise in referrals relating to that particular area. And more girls referred to that area as well. Safe and Sound and Catch-22 are the main providers of interventions and the specialist services, and there's also a regional group that provide that governance arrangements as well, but also consistency of approach. So we know that children move in between authorities, and actually, if they move, then we need to make sure that they're receiving the same levels of intervention. And just to kind of note that clearly COVID again has presented some challenges for us in terms of making sure that these particular children are safe, and the team have made sure that there are resource packs online to ensure that children can access interventions, etc., and that professionals have got all of those tools at their tips to work virtually if need be. Next slide, please, Lindsay. So the impact of training that's outlined on page 17. There's been quite a range of training delivered, and there's been a diverse range to lots of different organisations and professionals. So that's, again, as I said, is outlined on page 17. And some of the feedback has been really positive, and some of the quotes are there. So for Children in Care Council, because we've also provided training to our young people as well. So some of the quotes are there. So it was really good and made me think of a friend that might be in danger. So it's all about raising awareness, where children might not particularly recognise some of those triggers, and clearly we had engaged individuals during that training programme. Next slide, please. So our priorities, so that's priorities for this year, is really a continuation of what we had been doing the previous year and strengthening that, and the recommendations are on page 21 of the main report, and this absolutely remains a key priority for the city and for the safeguarding partnership. Children say that they feel safer because of the participation that they've had, and we've had that continued determined focus despite COVID, to ensure that we have extended and responded to that expansion of child sexual exploitation into child-related exploitation, being place-based risk. And I think if we think back to what Tracy was talking about through the Youth Alliance, we are very much looking at that external risk, and external risk is a key risk for particular children with exploitation. This is not necessarily safeguarding issues that are happening within the home. This is about what's happening in the community, and what pulls and triggers are within that child's local community that's drawing them into risky behaviours, etc. So we are ensuring that we are looking at those place-based risks external to the home, and that parents are included with that as part of the safeguarding framework around that child and part of the solution. and we're equipping them to ensure that they are part of the building of local knowledge and resilience for this particular group. Yeah, we have a continued dynamic education and training program, and of course we're seeking to improve those links with regional groups to respond better to any forms of exploitation across the city. And the final slide is a recognition that this has been a year like no other. And as I've said, we continue to have a strong partnership working, and this has been absolutely a key priority, particularly over this last 12 months, and will continue to be for the city. So I'm happy to take any questions on the report or on the presentation, Chair. Thank you.
Thank you, Sue-Ann, and again, thank you to the team that's worked really hard on putting this together, and also throughout the year protecting children and young people in the city. Is there any questions, Councillor Hazelgrave? Do you have any questions?
Well, I mean, I'd just like to say that, you know, the good thing is that there was a strong system in place, and it was there almost ready-made for when things came out of the woodwork. So this whole thing, as you would expect, that when young people were not in school for a considerable period of time, that they could fall prey, and some did, I'm afraid, fall prey to these county lines gangs and other forms of exploitation. You know, getting them to commit an offence because they wouldn't take it, the police wouldn't take it as far as they would for an adult, you know, and all that kind of stuff. I mean, it's awful that people, you know, it brings out the best in people. It clearly brings out the worst in people, this situation. But we do have a system there that's ready to, it's agile as well. It knows, right, we need to look here. There's a trend here. Let's get moving. Let's make sure there's a pack of stuff here. Let's make sure other professionals are working. We're all working together and all that kind of stuff. And it's very reassuring for me as a councillor, and I hope for the committee, to know that you work in that way and that you give the best service possible to the city by doing that. And that's all really I like to say. And thank everyone, you know, the team leader who couldn't be here tonight. Thank her and all her team for all the work they do day in, day out, quietly getting on with it, but being very effective, and hopefully helping many, many young people to take a step back from something that they may be kind of inclined to go down a path of doing. Thanks.
I mean, I think this is very much a partnership, a multi-agency approach, and it's not one agency that can take credit for to the safeguarding board, because this is a shared partnership priority. So it's, yes, whilst the lead was within my service, actually, you know, health, police, voluntary sector, you know, everybody has a part to play in this, which makes it all the better, really, because I think it really shows Derby at its best in terms of how we do respond to really critical issues across the city. Yeah, thank you.
Thank you, Sue-Ann. So can we all agree the recommendations, councillors? We all note the report? Yeah, okay, right, thank you, Sue-Ann. So moving over now to item 11, which is the topic review, which work programme and topic review. I think really we've probably covered what we're doing moving forward with the topic review on item 6, so that's absolutely fine. Are we all happy with that? We're all happy with the recommendations?
Yes, Chair. Yeah.
Yep. Okay, all that's left to say is thank you, everybody. I hope you all have a fantastic Christmas and make the very best of it of what we can. And we'll see you in the new year.
Same to you, Chair. Yeah.
Take care.
Have a good one.
Bye, Chair.
Bye.
Bye.
Good night.
Bye.
Bye.
Can you end the broadcast?